If you have a problem where you can hear these people over here who are a lot farther than the person in front of you, that is a hearing aid setting problem. Most of the hearing aids have as many as 115 separate adjustments. And if you have that problem, your hearing aid dispenser or your audiologist, and hopefully you're seeing an audiologist, is going to be able to take care of that more effectively. So it's time to go back for an adjustment. But lastly, I want to show you about what I do when I walk into noisy places. And we're going to use my iPad as an easier way of doing that. Now, I would do this normally through my iPhone, but it's easier to see it on the iPad. So one of the things that I would do is adjust the noise filter, or I can boost up the speech clarity if I wanted to. And I'm doing that on the fly. And sometimes I might be in really noisy restaurants, and we'll talk about that in a second, and I might flip over into the restaurant mode. I might reduce down the volume a little bit. There's all kinds of cool things that we can do on apps that we never were able to do before. See, most of our patients in the past had their hearing aids and they had no way to control them other than a few little tiny things. But these apps give you an ability that you have never had in the past. So with hearing aids that have 115 separate adjustments that I do, now this can give you upwards about 15 different adjustments that you can do. And by the way, I use it all the time. So it's a very effective means for you to handle that circumstance. Now, let me share with you a little problem that happens for understanding in noisy restaurants. Most of the time, anyone who's grown up in the 50s, 60s, 70s remembers one point. A quiet, wonderful restaurant was what we looked for because we wanted to communicate. But that's not what it is today. In the last 15 years, we've seen that dramatic circumstance change over to the noisy restaurants. Do you know why? The restaurants love to make it noisy so you spend more. But that makes it very difficult to communicate with them. And I got to tell my patients all the time, I would love to bring you back to perfect hearing. But my goal is to take you from this much problem and make you significantly better. But I'd like to bring you back to 18 years old again. Guess what? That can't happen. So those are some reasonable expectations that we look at, and I hope you listen a little bit more to them. Thank you so much.